Hello, I'm Gary Bebow, CEO of White River Health System, and this is my August CEO Connection. You know, the standard of the month for August is ownership, and I can't think of a better standard that we should be really applying right now. Recently, you saw in the newspaper where Baptist Health out of Little Rock had a layoff of some 170 employees due to the challenges associated with health reform. And I can tell you, it's really important that all of us take ownership in White River Health System facilities, making sure that we do those things that best position us to be successful in health reform. So please do your best, look for ways to improve our organization, and really take ownership in it. We have some new physicians joining the staff at White River Medical Center. Dr. Shannon Swift is an internal med ped starting in July. She sees patients of all ages, and her scope of practice includes primary care for adults with complex medical conditions. Dr. Swift's pediatric practice will focus on children of all ages with a special interest in teens and preteens, and she is located at White River Diagnostic Clinic. In addition to Dr. Swift, Dr. Dylan Carpenter is an orthopedist who will start on August 12th. His scope of practice includes fractures repair, arthroscopy, and joint replacement surgery. He's a specialist in minimally invasive orthopedic hip surgery, and one of the very few doctors in the state that can do that. And man, I think he's really going to bring some great expertise to us. He'll practice with Medical Park Orthopedic Clinic with Doctors Angel and Allen. Both these physicians will be great additions to the medical staff, and I'm really looking forward to their contributions to our level of services. The first year's program of ACE training will conclude in September of this year. If you are in a direct patient care department and you haven't attended it yet, you have August or September to participate. It is mandatory for those folks, and I want you to be sure to get involved. All the feedback I've got on the ACE training program has really been positive, so if you haven't participated, I know you'll really benefit for it. In October, we'll start the second series of ACE training, and that new program starts in October. All employees of the White River Medical Center will be required to participate. So the committee is currently putting together the programs that will start in October, and just like the first series of programs, I'm confident it will be really beneficial to us and to our patients. From a personnel standpoint, Renee Taylor, who's been the Stone County Medical Center Administrator, will retire effective September 30th, and we will have a celebration recognizing her for 5 years of service in that position. Renee really has taken a leadership role in the rebuilding of the hospital following the tornado disaster of February 2008. And she's been really instrumental in improving quality and doing those things that has made that hospital a success. So when the time comes where we can announce the retirement party, I hope that you'll plan on attending. Finally, I have a couple of other administrative additions that I wanted to make mention of. Dr. Doug Bernard is our Chief Medical Officer. He really started in April of this year, and he really serves as a liaison between administration and the medical staff, helping us with policies and procedures and making sure things that we do are sensitive. We're sensitive to the needs and the feelings of the medical staff. So Dr. Bernard is really doing a great job in his role. In addition, Dr. Mohammed Khan is our Chief Medical Information Officer, who is helping us with the implementation of the electronic medical record, applying it to the needs of the physicians, making sure it's physician-friendly, and that we get the maximum benefit from its use. So both these two physicians are new in their roles and both off to a great start. Finally, Laura Lenzen is an Associate Administrator, Physician Services, again starting in April. She really is responsible for our clinics and our physician offices, really helping us in making those provide better care and also just more efficient. So those are our new additions to the administrative group, and I hope you'll support them and assist them in their new duties. This concludes my August CEO Connection. Once again, I appreciate all the hard work you all have done and all the things that you're doing to make this facility a better institution. I encourage you to continue to do those things, and if you have any suggestions on ways that we can improve the organization, I hope you'll contact us in the way that will be on the screen that follows. So thanks a lot and have a great week.